Thank you for joining us this evening, Dr. Matarese, and the floor is yours.
Thank you so much. Well, I'm thrilled to be here. I hope that all of you will take home from this lecture some very important points about concussion. I think too many people still think of concussion as a relatively unimportant, a very minor condition that really doesn't have much in the way of consequences. And what you're going to find out is, just the opposite. Although most individuals who have a concussion will fully recover and recover relatively quickly. There are some individuals who do not, and there are certain circumstances where if you have a concussion and you are injured again before you fully recover, it can cause permanent and sometimes catastrophic outcomes. I know that we've all heard about concussion. It is something that has been on the news, multiple concussions raising concern about dementia later in life to our professional athletes. And we are more aware of the fact that young individuals who have concussions are at risk for consequences from multiple concussions. But I don't think most people understand what a concussion actually is. It's actually a mild traumatic brain injury. It's not actually a bruise or a black and blue. There's no obvious visible swelling or bleeding on the brain from a concussion. It's a chemical change. It occurs on a basis of individual neurons, the brain cells themselves being changed chemically. It's microscopic changes that are occurring. And it, of course, can occur in any sport, but most concussions occur not on the sports fields, but in day-to-day activities that any of us might do. We believe up to 90% of concussions are not sports related. And many times individuals don't even realize they've had a concussion until symptoms become very severe and they seek medical attention, because not all concussion symptoms present themselves right away. You can get a concussion either from a direct blow to the head, but only less than 30% of concussion patients actually have a direct blow to the head. More often, it's due to an indirect blow where the body is suddenly jolted. An athlete is checked, there's a sudden whiplash injury, and the head is either shifted or turned, and that twisting or shifting of the brain inside the skull causes the symptoms. The most common thing that I think most people think about concussion is that you need to lose consciousness. And what you're going to find out is that less than 8% of individuals who have concussions have actually lost consciousness. So it's a lot less common than what people previously thought. I like, oh, my camera's doing a little funny thing here, guys. I don't know why. I'd like to think that we are, as a country, are recognizing the significance of head trauma on a national as well as international level. The importance of concussions are being recognized, and this is a statement from an international conference on traumatic brain injury or concussion in sports. And this was from Zurich in 2012, and about every 4 years, international thought leaders on the field come together because what we are interested in doing is establishing the standards of care internationally on what we should be doing for our young athletes to protect them from permanent brain injury. Here, the international conference gives this very complex, very scientific report on what exactly a concussion is, what by definition they believe. And you could read it yourself. Concussions, a brain injury defined as a complex pathophysiologic process affecting the brain. So they're saying it's due to electrical chemical changes in the brain, and it's due to trauma, biomechanical forces. And again, the trauma most often is indirect. It's not a direct blow to the head. Oftentimes, there are some predisposing factors that increase your risk of concussion. If someone's had a prior concussion, you have a 4 to 6 times greater risk of having another. Certain individuals also are at higher risk for having a concussion, and the concussion itself is more often more severe and lasts longer if you have prior concussion or if you have any kind of neuropsychological problems. That includes things like anxiety, depression, attention deficit disorder, dyslexia, uh, things that you wouldn't think would be a source of problem as it relates to concussion. But absolutely, we have seen clearly folks with any of those, having more severe and more prolonged concussion symptoms. We are now also finding that women have a higher risk of having a concussion. You can have a male and a female athlete both in the exact same sport, exact same injury, and the female is at a higher risk for having the concussion than the male. We try to rationalize that, thinking about differences in body makeup and their physique. Many times, male athletes have thicker, stronger necks, maybe are at less risk for a whiplash, therefore less risk of having the brain shift. But we're also seeing there's clearly a hormonal difference between male and female in relationship to concussion. We see that at certain times of the month, a female is actually at a higher risk of having concussion. And we see that kind of hormonal change in other things neurologically. For example, I'm sure if you know anybody who has migraines as a female, oftentimes you'll have migraines, around the time of your cycle, during menses or premenses. Folks that have seizures oftentimes will also have them at an increased risk at this time. So we know that hormonal changes do affect our brain and affect how our brain is disposed to certain activities or injuries. What I think is very important that only recently has become apparent is that the younger athletes, the youth, the adolescents, are at a much higher risk of injury to the brain, more serious injury to the brain. The more immature the brain, the less developed the brain, the greater the risk. The injury itself can be more serious, and the duration of symptoms can be more serious. It'll take longer for those symptoms to resolve, and it continues up through about college level. It's the brains that have not fully developed. It's the young, immature brains. We think the brain typically will fully mature by 23 years old, sometimes a little bit longer. So it's these brains under 23 that are highest risk. The younger, the more potential serious consequences. It's no longer just the professional athletes that are having problems. I like this picture just to show you how even without a direct blow to the brain, the skull, excuse me, the brain shifts. And you can see here that brain is simply sitting inside the skull. It's not attached to the interior of the skull. It's surrounded by a sac of fluid, spinal fluid that acts like a cushion of water to insulate it. It's attached to the spinal cord at the base of the neck, at the base of the skull, at the top of the neck. But when any shift occurs or any sudden change in direction of the head or shifting with rotation, that brain can shift along with it. And this illustration shows how it can smack the interior of the skull front. It can ricochet, strike the back, and depending on what part of the brain is injured, whatever that part of the brain controls will malfunction. This is an illustration of a neuron. Neurons are the brain cells. These are microscopic, and a normal neuron carries current just like a wire carries current. It's a little different because it's not metal and rubber insulation. Instead, it's living tissue. It's nerve tissue surrounded by this fatty glob, that basically allows the current to skip between these insulations or these globular structures, causing the current in the nerve to change, to shift. That's how signals are sent along a nerve. There's this electrical shift or this electrical depolarization that changes the current, and this nerve current will shift along. And one of the mechanisms you can see here is that along the lining of these nerves are little channels or little gates. And when the electrical chemical reaction occurs that causes a shift in the current or the polarity, sodium channels open up, sodium rushes in, depolarizing it, and then when it recovers, the sodium goes back out. But when somebody has a concussion on a microscopic level, these channels are temporarily paralyzed. They're immobilized. They're made ineffective, so that there's a sudden increase or flood of sodium into these interiors of the brain, of these nerve cells. It's followed by calcium and followed by increased water contents. You get these swollen, inactive brain cells, which then have to decompress in order for them to work normally again. I wanted to show you this picture. We call it the homunculus. This is the mapping of how our body lays out on the brain. This is an illustration of the two halves of the brain. And you could see, from this illustration that a lot of the brain, the sides of the brain, especially, are controlling our face, our tongue, our lips, our eyes, our hand. And then very little else of the brain is controlling the other parts of the body. And depending on where you have impact from the concussion, as you see illustrated on this picture, you'll see defects in that part of the patient's functioning. So whatever part of the brain is hit, it temporarily malfunctions. And this just gives you an idea why it can be so varied. So what are the signs of a concussion? Most individuals with concussion have headaches, they're sensitive to light, they're sensitive to sound, they're very fatigued, they report difficulty with focusing and concentrating. In school, children will often have trouble taking notes, they won't understand what the teacher's saying, they have trouble seeing the board, they're sensitive to both light and sound, they can become more irritable, they can be off balance or dizzy, they can forget what they're doing even within minutes of being told how to do it. Oftentimes you can see this in an individual who's had a concussion. They may appear dazed or off balance, they seem sluggish, they have difficulty responding to simple questions. The younger the child, the more difficult it's going to be to get out of them if they've had signs of concussion. Remember, the younger children do not have the vocabulary that an older child or an adult would have. So oftentimes when I'm dealing with very small children, elementary school, who do have a concussion, rather than saying, I'm sensitive to light, I can't focus, I can't concentrate, I feel sad, I'm anxious, I can't sleep, they'll say, my tummy hurts. It always seems to be related back to that belly. And you then have to play detective to try to figure out what symptoms they really have, and could it be a concussion? The other thing that I think is really important is that the symptoms do not always occur immediately. Yes, you can sometimes have concussion symptoms immediately. For example, if somebody does have a direct blow to the head, they could lose consciousness or see stars or feel nauseous and vomit. But oftentimes, concussion symptoms are delayed for up to 24 hours or even longer. So you can have a child coming in and saying, I have a headache, I'm dizzy, my eyes hurt, I'm sensitive to the light, I want to go to sleep. And you think they're having a virus or a reaction to a medication or something else. And you may not even think about the fact that, gee, they were out playing, soccer or lacrosse or football yesterday with their friends. I wonder if they may have had a concussion. And it's important, as you'll see shortly, why you need to make that diagnosis, why you need to identify that problem with the child, what's causing their problem. Now, there are some warning signs, some danger signs that are more serious. If you have somebody who you think had a concussion and you start seeing them becoming progressively more tired, more drowsy, more difficult to arouse, they have progressively worsening headaches, they seem weak, they're complaining of numb, they look drunk, they're slurred speech, their eyes are moving back and forth, they're unsteady, they have recurrent nausea or vomiting or slurred speech, if their pupils appear to be uneven. These are signs of potentially catastrophic injury in the brain. It may not be a concussion, even though that's initially what you might have thought. These are medical emergencies. They could be, life and death situations if it's actually a bleed in the brain, and 911 needs to occur. But any time you see somebody with a concussion who is lethargic, who has lost consciousness, who is unsteady, who has slurred speech, you're best to bring them to the emergency room anyway. Call 911 and get them checked out. This statement here, there is no such thing as a minor concussion, I think is hugely important. I have somebody, as you can tell, I have a puppy with me here who wants to talk on this presentation too, but I'm not going to let him talk. There is no such thing as a minor concussion. Every individual is unique. Every concussion is different. Every individual needs to be seen. There is no simple minor concussion that should just be written off. Everyone needs to be evaluated by somebody who is a specialist, well-trained in how to evaluate a concussion and how to treat a concussion, because without that, you're going to be placing them in harm's way. This slide, if you recall nothing else from my lecture, I ask you to please remember this one slide, because this is the reason I do these presentations. This is the reason I do lectures on concussion. There is something called second impact syndrome. Second impact syndrome. This is a condition that occurs if somebody has a second concussion before they fully recover from their first concussion. If they are still having symptoms and they get a second injury, whether it's a direct blow to the head or a shifting, like a whiplash injury and the head is shifted, there can be a sudden, dramatic set of consequences that occur in the brain that result in sudden increased pressure in the brain, swelling in the brain, and this can result within minutes, permanent and irreversible brain damage and death. This is the reason we have these rules, not only here in the States, but internationally, when a student should be allowed back to contact sport, because we know if somebody has a second injury before they fully recovered, they're at risk for suffering this second impact syndrome. And this occurs only in the young, only in the individuals whose brains have not yet fully developed. So anyone under 23, the younger, the more risky. And it doesn't have to be a serious blow to the head. It could be a minor initial concussion. It could be a minor second injury, like an elbow or a sudden whiplash. It can happen within minutes, hours, days, or even weeks of the initial concussion. So this is why you need to be on guard looking for the signs of concussion, because if somebody has a concussion, a young person has a concussion, and you allow them to go back to sports or gym or playing ball, and they are hit again or they are shifted, you could be putting them in serious and permanent risk of injury here. And this is a real thing. I mean, fortunately, most individuals who have this do not die, but I have many individuals in my practice who are left with permanent and irreversible brain damage. And what's even more catastrophic is that many of these individuals were scholar athletes. They were the best in class, the high achievers. Baby, come on. My little puppy, as I said, I didn't want him to talk on the show. Well, he's talking. I'm sorry. But many of these individuals were scholar athletes who were self-motivated, hardworking, had to be the best at everything in school, in sports and everything. And they had minor injuries, ignored them, pushed through, didn't tell anybody that they had them. And it caused somebody who was top in their class to go to a point where they no longer could go to school, had permanent irreversible damage. This young lady here, Anushka, is one of my spokespersons. Anushka is somebody who was a Rhodes Scholar. This is a brilliant athlete who had a minor second injury biking in England, slipped off her bike, slipped on cobblestone, fell off her bike, did not directly hit her head. It was all indirect, but it caused her to have a concussion with cognitive impairment that prohibited her from being able to read or study or continue in her graduate work, caused her to have constant headaches and constant dizziness for over 2 years. She's still an active patient in my practice and still has not fully returned to her normal state. We hope she will, but there's no way of knowing. So it is a very real thing that we see. JR, the fellow here who's playing for Rochester. This is a scholar athlete who's a nuclear physicist major who was running the laser lab at Rochester, had multiple concussions, and had this second impact syndrome where he was out of school for over 2 years, unable to continue with his work, has recently gone back to school, taking a limited number of classes, still struggling over 2 years later. And unfortunately, this is the typical story that you see where you have these kids that are hardworking, dedicated, they don't want to give up, they're willing to fight through it, and they're the ones that get this trauma. We've known about concussions for centuries. You know, the ancient Romans, the ancient Greeks, in their writings and their drawings, talked about individuals with concussions. Here you see on this illustration, they have an attempt at using boxing gloves to reduce the risk of concussion in a combatant. This is an illustration from Mesopotamia. This is the oldest record that they have of concussions. We have a fresco here, from 1600 BC, again addressing the issue of concussions, trying to use boxing gloves to reduce the risk and prevent brain damage. Over the centuries that we've known of concussion, it's interesting that the number one thing that is important with concussion is recognizing it, recognizing there was a concussion. Number two, preventing that person from being re-injured and leaving them at risk for permanent brain damage. Number three, allowing that brain to rest, allowing that current, that electrical potential current that I showed you earlier in the brain that suddenly becomes stunned when there's trauma to the brain, allow it to reestablish normal current. And the way we do that is by allowing the brain to rest. The patient has to rest typically 1 to 3 days. In the past, we used to have people rest in a cocoon-like state. They'd be put into a dark room, curtains drawn, no television, don't leave the room. They'd bring up a tray for weeks. And we have found this is very detrimental to these individuals. We want these young brains to be active, back in school, doing what they're supposed to be doing as fast as possible. But initially, when the symptoms are most severe, we know that allowing the brain to rest does hasten recovery. If we don't do a phase of initial rest, 1 to 3 days, it will prolong the duration of their symptoms significantly. So we want physical rest, no running around, no sports, no exercising. We want brain rest, no texting, no playing computer games. We don't want them having to study and prepare for upcoming tests or read or do projects. We want that brain in a shutdown mode so that the area of the brain that is injured can get the nutrients from the blood supply to heal, to have our immune system get over to that part of the brain that's been injured to make the recovery. By having them physically exercise, you're shunting blood away from that part of the brain to the body. By doing mental exercise, studying, reading, playing these games, you're shunting it from a part of the brain that really needs it to parts of the brain that don't need it, and you're just delaying that recovery. So it is very important to do the rest, and I typically recommend that they rest until they're able to pay attention consistently for about 30 minutes. At that point, they should be back in school with accommodations. Our children's number one job, the most important thing for them is to be in school, to learn, and we want to do everything we can to make that happen. This is a photo of Grant. Grant is another one of my scholar athletes who had a serious head trauma. He had multiple traumas as an equestrian, and he developed what we believe was a second impact syndrome when he was only in 8th grade. So we have somebody whose high school career was dramatically altered and his whole life put on hold until he was able to recover and get back to learning at a very minimal rate initially. And as he improved with rehabilitation, cognitive therapy, he was able to advance and is now in collegiate levels of education, still an active student, still an active patient, still having significant trouble, never fully recovering. Oftentimes, what a teacher will pick up and what you may hear about from the teacher is that your student's not paying attention. They're not focused, they're not attending, they're not performing the way they normally do. So, the teacher who spends oftentimes a lot more time with the students than the parents pre-COVID, and now hopefully again with in classroom learning, they'll see these changes in a child's attention, their ability to focus and concentrate, their ability to interact, their mood. They can become more irritable, they can be dismissive, they can be combative. And we find that if we allow a student to rest and then go back to school with very limited activities required, they do better. For example, allowing them to go to school with temporary accommodations, for example, allowing them just to sit in class and listen, try to absorb what they can, but don't require classwork, don't require homework. Ask the teachers to write off anything that was missed. If there's a test or project coming up, let them delay it until they further recover and are able to take it, and do well on it. If you don't give them these accommodations, they become overwhelmed. Their symptoms will worsen. They can become depressed. Depression, anxiety are very common signs that we see with concussion, and oftentimes people aren't willing to ask about it or talk about it. We've also seen increased suicides with young individuals who've had concussions, and this is a very real thing as well. This is not just something that might happen, and we've seen that happening in some of our scholar athletes in this vicinity as a result of multiple concussions. We also want the student to know that the teacher is on their side. The school will work with them. They will make accommodations to gradually get them back to full academics, to help them learn what they need to do, to make up what they absolutely need to do so they don't have to worry about their grades. So many of these students are in a situation where they're trying desperately to get into a good college. It's very competitive, and they're afraid of even missing one day of class. And the school recognizes that. It's also not something that the teachers can see. Think about a concussion as an invisible illness. The child may look absolutely normal sitting in class. The teacher may not understand that they're having trouble seeing, or they're having headaches, or they're dizzy, or they can't focus, or they can't take notes. Make sure that if you have a child with a concussion, that your doctor, before they allow them back to school, has to see them, clear them, and allow them to school, and give them a note specifying what accommodations might be best based on their symptoms. For example, if they're sensitive to light, let them wear sunglasses or a cap or a visor. If they're having trouble focusing and concentrating, have them position them in the front of the class, dead center, so there's less distraction and there's less difficulty with them seeing the board. And it's also closer and easier for them to take notes. If they're having any kind of fatigue, let them take breaks, scheduled breaks throughout the day in the nurse's office. Doing these temporary accommodations will let them learn better, advance better, and get back to a normal schedule better. But again, don't be afraid to tell the teacher, tell your child, don't be afraid to ask for help, because unless they do, they're not going to know that they need that extra help. And what we have found, without question, by limiting the work that they have to do, by allowing them to advance at their own rate, they can adapt better. And these other things, like visual impairment, can be compensated for. Oftentimes, if they're working on the computer, if you increase the size of the font on the computer, it's easier for them to see it. Lower the background light for them to be able to read better if they're sensitive to light. Sometimes if a student has eye problems, sensitivity to light, and focusing problems, we need to provide them printed copies of all notes for each class in advance. And the teachers oftentimes can provide that without difficulty. You want to also pay attention to other things they're doing in school. For example, their lunch break. I don't want a child with a concussion who's off balance, who has headaches, who's sensitive to light and sound, who's dizzy, to go to the cafeteria where it is, pandemonium, where the lights are bright and they're screaming and things are being knocked around and people are pushing. Those children should be allowed to have their lunch in a private, quiet place where they can rest. They should be able to do that with another friend. The school nurse or administration should be able to coordinate that for you and tell them where they can go for these. So there's things that we can do to make that accommodation work and have that student advance as best possible. I think we've covered all these already. One of the things that you can look for, there's no one particular sign of concussion, but one of the things that I see very commonly is that when somebody has a concussion, oftentimes their pupils react abnormally. Their pupil may look much larger than expected, even in the dark, where you would expect the pupil to be large like this. If they come inside and there's lights on, the pupil stays wide like this. It'll stay like this on a bright, sunny day, which is why they're so sensitive to light. There's too much light getting into that retina, causing pain. In the classroom, oftentimes the fluorescent light is a real problem, and that's why we need to allow them to wear sunglasses or reduce the background light on the computer so that they can see more clearly. The other thing that I see very commonly is eye movement abnormalities. This illustration shows that the eyeballs are attached to 6 different muscles, and these muscles attached to each eyeball, causing them to move in very specific manner. The brain, each half of the brain independently controls each eyeball, and it sends signals to the eyeballs in 100,000th of a second when the brain wants the eyes to look in whatever direction it wants to look at, and the 2 eyes move in sync. But think about it, if one half of the brain is injured, is bruised, the signal to that one eyeball and to those muscles in that eyeball are going to be delayed to the side where there's weakness or injury from a concussion. So that, for example, if the brain wants the eyes to look to the left, and the left side of the brain is where the injury was, the signal gets to the right eye on time very quickly, and the right eye starts to move, but there's a delay before the signal gets to the left side of the through the brain on the left side to the eye because of that localized swelling. So it's basically as if that student is seeing double, and then it straightens out, and then double again, it straightens out in 100,000th of a second. But what you can see is that the eyes look like they're beating back and forth. It's what the police officers look for if somebody is stopped for suspected intoxication. If you have your son or daughter and you think has a concussion, if you just pick up your finger in front of their eyes and have them follow their eyes with your finger, you can actually see this kind of quick jittering or bouncing quality side to side. Sometimes the eyes can't follow an image smoothly. Instead, the eyes move like a little robot, stop, go, stop, go. And those are all very common things that we see with concussion that you can look for. We've known about concussions, I said, for centuries, and Hippocrates was the one who most notably wrote about it. But we're also seeing that we recognized it was importance. Here is a 12th century manuscript from the church, and what they found was that even in the church scripture, they had a section on concussions, describing them, but not actually knowing what to do with them. But I just found it really interesting that here we have for centuries known about concussion, but not understanding until very recently what causes them and what we should do about that. We've also come to realize how trauma to the head can affect us, not just in physical ways, but emotional ways. I like this picture. This is somebody who had a traumatic brain injury, Phineas Gage, and he's famous because he was a railroad foreman back in the mid 1800s, and he was working with a crew putting in railroad uh, ties and the rails on top, and they were using these large metal rods or tampers, to put in the the studs that were keeping the rails in place. And by accident, one of these rods, was shot off, ejected, and went right through Phineas Gage's eye and lodged in the front of his brain. He did not lose consciousness. He did not have any physical abnormality whatsoever. He and his colleagues were able to go to the local physician's office, where he walked in and notably was asked, what brings you here? And he said, I thought this would be obvious. He was able to talk, move, had no symptoms other than this rod in his head being painful. But what they found was there was a dramatic change in his personality. He went from this very proper, upstanding member of the community to an individual that became uh, a drunkard, a gambler. He was profane. He was inappropriate. He didn't take care of his family. He didn't go to work. And with this frontal lobe injury, we saw this dramatic change in personality and behavior. We see this kind of dramatic change also in concussions, fortunately only temporarily. If there's any blow to the front of the head, that frontal lobe is going to cause a change in one's personality. So sometimes, you may see it in your child or young relative, especially teenagers. There's a sudden change, they're moody, and then you wonder, what is this? Is this hormonal? Is this just, trouble with teens yet again? Well, if it's a sudden change, think about there may be a problem with that frontal lobe. There may have been a blow to the head that they didn't recognize, or an injury that didn't even include blow to the head, but it could be concussion. Don't ignore it. Check it out. Ask, what happened in the last 24 hours? Was there anything that you had been doing? Were you fooling around? Were you roughhousing? Something that could have explained, this sudden change. We're also now much more aware of concussion because of the NFL, the football players. And this has been a problem that's been known for, 100 years. I know that over 100 years. I know that when the NFL in recent times was told that repetitive head trauma is causing dementia in their players that are retired, and personality changes and suicide, they initially denied it. But the NFL, the football leagues have known about this problem since the early 1900s. I like this article. This was from the Chicago Sunday Tribune, 1905, and the article is "Football Year's Death Harvest." There were so many young men that were playing football that were dying. Here they talked about 19 players in that year that had died, and 137 that were seriously injured. At that point, if you look at this picture, you see there's not a lot of equipment. Some of these guys don't have helmets, they don't have padding, they don't have anything at all, face guards. It was really come as you please, and there were very few rules. And it was after this that Teddy Roosevelt, who was the president at the time, initially thought about outlawing, banning football in this country. And he met with the leaders. These were all, by the way, these were all Ivy League schools. I think this was a Harvard Princeton game, but these were Ivy League schools that came together, with the president and his team, demanding safeguards be put in place to try to prevent permanent brain damage and death. And they basically said, if we put up a set of example for fair play, that alone will reduce the risk. And this comment of fair play, it still holds today. Too many times I see athletes that have come to me after being injured in a sport game, only to find out that they are the best member of that team, and the opposition took them out because they were the best member. They were the ones that were scoring, all the points, or directing the best plays. And the opposition realized, oh, we've got to get rid of them, otherwise we're not going to win. This is not a mentality that we should be encouraging, in our children. These games are supposed to be fun and healthy and improving their ability to interact in a society where some people win, some people lose. We're all very different, but we can all get together and be as one as a community. We need to totally eradicate this idea of taking out the best player, killing them, hurting them, getting them off the field, because what they don't realize is that these young people that are injured for the rest of their life in so many cases. And we just can't let that happen. So, being a good sportsman, following the rules, wearing the equipment, all of those things reduce the risk of permanent brain damage. I think everybody that's watching now has heard about, Dr. Bennett Omalet, and he was a neuropathologist who did an autopsy on Mike Webster, who was a football player for Pittsburgh. And this was a gentleman, Mike Webster, who was very popular. He was a real role model when he was playing, but something happened to him later in life. He became, quite degenerate. He was homeless. He lost all his money. He was using alcohol. He became irrational, inappropriate, abusive to his family, and they found him dead. And when they did the biopsy, the autopsy, Dr. Omalo realized that he was seeing changes in the brain that looked a lot like Alzheimer's. It wasn't exactly Alzheimer's, but it looked a lot like Alzheimer's. And he was the first one to publish this finding that somebody who had suffered multiple cerebral concussions ended up having this change in their brain, pathological, objective changes, in addition to cognitive impairment, inappropriate behavior. And he is who really launched the whole further study of allowing us to get where we are right now. Anne McKee from Boston University took over where Dr. Omalu ended, and she has started and is working with something called the Legacy Foundation, where they are obtaining brains from individuals who have died from dementia or this chronic traumatic encephalopathy, from athletes, both professional and not, and they're doing autopsies. And what they're seeing is exampled in this bottom left picture, where you see cuttings of the brain, slices of the brain. The top two picture is a normal individual. That's a normal young adult's brain. The pictures below are somebody who has chronic traumatic encephalopathy. The brain itself has shrunk down. There's fluid-filled sacs in the center of the brain that should normally be just little slits, but instead you see them as large cavities. The surface of the brain, the gyrations, the grooves have changed into what looks like a raisin. And Dr. McKee made national news about 2 years ago, possibly 3, when she published this illustration of a high school athlete who had died, who had killed himself, who they suspected to have chronic traumatic encephalopathy, even though he was still in high school. Prior to this, we thought you had to be a professional athlete with repetitive trauma to the brain for about 10 years. Now we're seeing, gee, this can happen from repetitive head trauma at a much earlier stage in life. And it further supports what I was trying to say earlier about second impact syndrome and repetitive head trauma. Somebody who's having repetitive head trauma sweetheart, I have a very loving dog. I'm sorry, guys. Somebody who's having repetitive head trauma without allowing the brain to heal in between can be left with permanent and irreversible brain damage. To make that one step worse, we're also finding now in somebody who's had repetitive head trauma, we think there may be developing an autoimmune response to the protein in the brain that gets dislodged when somebody has a concussion. This protein from the brain, the protein from the spinal fluid, they should not be in our peripheral blood, in our veins, but they are now seeing that there are certain proteins that are being dislodged, that are getting into our bloodstream, and our immune system, we believe, is attacking these. So we're now seeing antibodies, these abnormal proteins that are against our own body, like an autoimmune disease, where it's attacking us. And we think this condition, this chronic traumatic encephalopathy, isn't just the result of multiple repetitive head trauma, but in addition, this autoimmune disease as a result of the head trauma and the protein being dislodged. We see that in many of these older athletes who have continued to deteriorate many, many years after they stopped fighting. Anyone who's seen Joe Frazier, Muhammad Ali, noted that it was many years after they stopped getting repetitive head trauma that they developed what looked like Parkinson's disease and dementia and inappropriateness, walking abnormalities. It's many years later. We're seeing individuals that look like Alzheimer's, that look like Parkinson's disease, that look like Lou Gehrig's disease, but they're not. They look like it because they have this chronic traumatic encephalopathy from repetitive cumulative trauma, in addition to the body's immune system attacking it. We're now seeing that there are what they call biomarkers, blood markers that allow us to monitor what's going on in the body. And someday with these biomarkers, we're going to be able to get a blood sample where we can analyze a specific blood marker to tell us if somebody's had a concussion, and also to monitor the recovery by monitoring this blood level, and when it resolves and returns to a normal level, knowing that it has fully recovered. It's something that's very important for things like return to play. We don't want a child to go back to sports if they're pretending they're all better, when they're really not. And a blood test like this would confirm it. We don't want somebody in harm's way, like our military or our police or other security, getting back into harm's way unless they fully recovered. Again, it's a way that we're going to be able to do that. So knowing, in the future that we have these biomarkers and also radiologic changes that are very real, that are present already. In fact, we at Capital are working with Princeton University and Temple University on a study on high school athletes. We're looking at blood markers. We're looking at this specific type of imaging of the brain. This is a special kind of MRI, diffusion tensor imaging MRI, and you can see that we're actually identifying pathways, brain pathways, where different parts of the brain are carrying signals. Individuals who have had repetitive head trauma, these pathways are shrinking, they're shortening, and we're seeing these permanent brain damages that we previously couldn't see. If you have somebody with a concussion right now, go to the emergency room, we do a CAT scan or an MRI, it looks normal. But with this new technology, we're going to be able to see things that we couldn't see before, and then also monitor their progress. So here we have the diffusion tensor imaging, which we're doing already at Capital, but only in research, and it's not available for clinical use yet. Here we're seeing a chemical study where we're seeing electrical activity, chemical activity in the brain, and then we're looking for areas of the brain that are malfunctioning. So there are things on the horizon in the very near future that I think are going to make a huge, huge difference in how we treat somebody. I'm at the end of my time. I know I kind of hurried there, but I wanted to get everything in. I want to end on this very happy note. This was a beautiful young family who sent me a thank you note on saving their mother. Somebody who had serious potential head trauma that we were able to avert long-term consequences. So it has some real life significance, where we had this family that would have otherwise been devastated, if we hadn't done the right thing in a timely manner. I want to open up for questions now, if that's okay, and
Yes.
then we'll cut it. We'll end it for the rest of the night.
Okay, so thank you for the presentation. Also, don't forget to fill out the evaluation forms. So right now we have one question, well, two-part question in here. I'm going to read it for you. It says, I have sustained 3 concussions with neck injuries in less than a 2-year period of time. My first concussion was from an automobile accident. The second and third concussions were due to being assaulted by 2 different students in 2 different school years. Is post-concussion syndrome a permanent condition? I also been diagnosed with post-traumatic migraine headaches. Is this permanent as well? Are either of these considered to be disabilities? Thank you so much.
Okay. First off, the questions that I answer, I can only talk in generality. I can't speak to any particular patient's direct symptoms, your particular condition. I'm not allowed to do that. But uh, number one, post-concussion syndrome uh, is something that can go on for many years. You need to make sure that is the correct diagnosis. And if you are suffering from symptoms that are prolonged, you may want to explore getting another opinion, a concussion specialist, someone that does the kind of thing I do. There are also traumatic brain injury specialists that are rehabilitation specialists that work with us. But I think number one, you want to get a second opinion to confirm that diagnosis. Are they disabilities? Yes, they are. And it would interfere with your potential for employment, for quality of life. In many ways, it interferes with you. And although the duration of time between each of those injuries sounds pretty long, if you had some permanent injury from any one of those, it would just be magnified by the subsequent concussion. So I think the most important thing for this particular individual is get another opinion, see somebody who's a specialist in the field, and help them, have them assess what is your diagnosis. Post-concussion headaches or post-traumatic headaches are very common. Probably the majority of individuals who I see with concussions have some component of post-traumatic headache. It could be a post-traumatic migraine, or it can be musculoskeletal, because oftentimes there's concomitant injury to the neck, whiplash injuries, injuries to the ear, injuries to the jaw, other musculoskeletal structures that can cause chronic intractable headaches. So again, you want somebody, a neurologist or rehabilitation specialist, traumatic brain injury specialist, to see you reevaluate those diagnoses to see, has something been missed? That's always the best thing, I think. They may assume it's all post-traumatic headache, and it may end up being you have a slip disc in your neck, you have a pinched nerve, your jaw's out of alignment. There's other things that can be happening that collateral damage that may not have been picked up. So get that second opinion, please.
And the second question is, I work with older adults and we spend considerable amounts of time sharing false prevention tips that can sadly also cause concussions. Do you see many older adults in your practice?
Absolutely. Earlier, I talked about the frequency of concussions and how many of them were occurring. And I said that most concussions are occurring off the field. 90% are occurring off the field. Many of that 90% are elderly individuals. I mean, concussion occurs at all ages, but because many of these elderly individuals are unsteady, they're off balance, they're visually impaired, uh, they may have problems with their hearing and their balance. Uh, they may have orthopedic issues. They're at a higher risk. So very commonly, we see individuals with concussions, elderly. The difference between the elderly and the young is that the trauma that we see from their concussion uh, ends there. Whatever injury they suffered, uh, we can work on it to try to fix the problem with therapy. There's therapies for concussion that many people don't know are available. If they're dizzy, if their eye movements are off balance, their vision's impaired, there's vision therapy. There's something called vestibular therapy to work with balance and coordination. Physical therapy oftentimes can work with the musculoskeletal component to these injuries. So there's therapy available, and with an older person, will employ those therapies to try to get their symptoms under control or use medication to get it under control. It's the younger people where, when they have a concussion, that we need to be that much more diligent at prohibiting them from doing any activities that could result in a second concussion until that first concussion fully resolves, to prevent permanent damage. Because in that younger individual, they're the ones that are at risk for going on to, permanent and, potentially catastrophic outcomes.
I have a statement here, and it says, "Thank you for offering this informative lecture. I own a wellness center in Newton, PA, and work with people with neurological issues through the Neuro Studio. I have clients with MS, Parkinson's, strokes, and concussions." And then another question is, what is your experience working with veterans?
Well, veterans are hugely important, because we're not only veterans, but active military as well, because we've had many individuals with blast injuries. The severity of these blast injuries, either in the military or in police, the severity is so significant that they can go on and develop chronic traumatic encephalopathy, even from one isolated episode. Again, allowing this neural tissue, this brain tissue, to escape, into the bloodstream where it shouldn't be, allowing the body to attack itself, recognizing this abnormal protein in their blood. So we see that in individuals with any kind of military service and or security, police. Many times, veterans have also had multiple repetitive head trauma with active duty. So it's a common thing that we work with the VA, as well as, active duty members of our military, because they are putting their brain and life at risk, with some of these activities they do. And we have to evaluate them like any other patient, try to determine what their problems are. Is there cognitive impairment? Is there eye movement abnormality? Is there balance or coordination abnormality? And the patient, depending on what they show, there's then further testing we can do as well. We may end up getting imaging of the brain to make sure it was truly a concussion as opposed to a bleed in the brain from head trauma. There's something called neurocognitive or neuropsychological testing, where we can evaluate their intellectual functioning, memory, thinking, processing abilities. And sometimes they can benefit from cognitive rehabilitation, or eye movement therapy, vestibular therapy for balance, coordination, walking, you name it. So, absolutely. We appreciate their service. We thank them for their service, and we're here to help them in any way we can.
And there's no more questions, but we have a comment from Eileen. It says, "Thank you so much for this lecture. Excellent," in capital letters.
Thank you. Thank you. Thank you all. I'm so pleased. And if you would all please just promise, share this with your young members of the family, share it with parents and grandparents, that, if you have any signs of concussion, please don't ignore it. Please get an evaluation by a physician who's trained in evaluating and treating concussion. Don't let them risk their life and their intellect, by allowing them back on the sports field. It's a game. It's not important, in the overall scheme of life. We want them healthy and active. We don't want them permanently damaged. So do the right thing and protect them, and be safe. And all of you, stay healthy, you and your families. Thank you so much.